And so what were you saying about Jack and weight?
Are you aware of the link that weight has with Jack's asthma?
But Jack's not... What do you mean?
Okay.
Are you saying Jack's fat?
Let me show you. When Jack came in, we did take him to the treatment room and measured his height and his weight. And I have plotted it here on this graph because as kids are growing, we need to monitor that they're growing in a healthy fashion. And this is where Jack is at the moment. And as you can see, he's in the yellow area.
Look, this doesn't really make sense. I mean, I just really came to talk about his asthma, and what are you saying now? That
Sure. So
it's an unhealthy area?
Yeah, so ideally when we're looking at kids a similar age as Jack, they need to be in the green zone. That's the healthy weight. Jack finds himself here in the yellow, which is above a healthy weight. And then kids in the red are well above a healthy weight.
So he's right up here, almost in the red.
Yeah.
That just doesn't make sense.
Yeah. Look, it's so hard to tell whether a child is at a healthy weight or growing appropriately or not just by looking at them. And that's why as GPs, we have a duty to measure these things and plot them on the graph that's appropriate for their age and also their gender to make sure that the child's growing appropriately.
So has this got anything to do with his asthma?
Yeah, there's a lot of evidence in the literature that tells us that as a child becomes above a healthy weight, the asthma usually gets worse.
Oh, okay. So, well, how do you suggest we help him with his getting it into the green?
Sure. Look, there are many good resources that we have, and what I'd like to do is give you this handout that has 8 particular areas that we can work on. Don't be alarmed, we don't have to do them all right now, but there are various things that we can do as a family. We're going to be working as a team to help support you, your partner and Jack in making some lifestyle changes. But today you've come in for the asthma, and I want to make sure that we are well on top of Jack's asthma and to just update his his action plan. But if it's okay with you, why don't we, when I see you in a week's time to review Jack, make a double appointment so that way we can also discuss further how his weight is impacting on his asthma and what we can collectively do to improve this.
Well, I just had no idea that he was at all overweight.
Yeah.
You're saying he's actually almost, would you say, obese?
Well, look, other medical professionals would term him borderline for obesity, but we like to use the term above a healthy weight because the bottom line is we want to help Jack and support you as a family to make sure that he grows to be a healthy person and a healthy adult.
Wow. It all sort of sounds a bit complicated, actually.
Okay. I can understand how you would feel like that, and I can see from your body language that you're a bit concerned. But the good news is I'm here to help, and you don't have to do it alone. And there are a lot of resources and a lot of team members in our practice who are here to help.
Okay.
So is that okay with you?
Well, that's okay. How do we start?
Sure. So let's get cracking basically with his asthma first, and we'll see you next week for a double appointment so we can tackle some of these issues here that are identified.
Okay.
Is that all right?
That's great.
Fantastic.
Thank you.